Welcome to Baddie, a monthly podcast by For the Breast of Us, the first breast cancer community for all women of color, where we share real-life experiences, information, and education to help you live your best life after a breast cancer diagnosis.
Hey girl, hey. My name is Tesha, and I am a breast cancer survivor and a Baddie volunteer at For the Breast of Us, which is an organization for all women of color that has been impacted by breast cancer. And today I am joined by my friend, Miss Tatiana of Chemo Divas Foundation. And today we're going to be talking about healthcare disparities for Black and Brown women that face breast cancer. So before we get started, Tatiana, first of all, welcome. And can you just tell our listeners a little bit about yourself?
Yes, well, thank you, Tesha. I'm so excited to be here. So I am Tatiana Tate. I'm the founder of Chemo Divas Foundation. Our organization supports women of color impacted by cancer. My mom actually had lymphoma, non-Hodgkin's lymphoma. And as her primary caregiver during her treatment, I just saw that there was so much work to be done in the healthcare space for the women in our community. And so that's how Chemo Divas was started.
Love it, love it. Well, welcome again, and thank you for taking the time out to come and talk with us this afternoon, well, this evening rather. Well, let's dive right into it. The unfortunate reality that we are facing right now as women of color is that we are getting diagnosed at later stages when it comes when we're getting diagnosed with breast cancer, and unfortunately, the survival rates are low because of that. Some contributing factors with that is lack of quality healthcare, stigma, cultural stigmas, and also, implicit bias. So that plays a big part with women of color being diagnosed at higher rates, and also being diagnosed with later stages of breast cancer. So talk to us a little bit about, well, how does Chemo Divas Foundation, how does that play a part in it?
Yeah, absolutely. So one of the things that we do, which is what we kind of started with, was sharing women's stories. Mm-hmm. When my mom was going through her cancer treatment, we just had a hard time finding women of color who were in a similar situation to be able to kind of relate to them, understand how they got through their treatment or kind of any disparities that they faced. Right. During their time as patient survivors or whatever kind of status they were. And so a big part of what we continue to do is try to shine a light on women and just determine kind of what were their lessons learned. How did they navigate, a healthcare team that they felt like they weren't being able to communicate properly to, or how were they able to navigate the clinical trial process, even the financial obstacles that come with a cancer diagnosis. There's so many pieces of the puzzle that I feel like aren't discussed enough. And you go to the doctor and maybe you have 15 minutes with your doctor or your social worker or whoever it may be. But I think that it's so important that the women in our community are able to talk to people and see people who have been through those experiences, who are in their shoes, and to learn from one another. So we're definitely each one teach one. How do we, share our experiences, our mistakes, and so that the women coming behind us are able to be better equipped to beat those statistics and beat those disparities.
Right. And one thing that as you were talking that stuck out at me, just in the African American community, we don't talk about our family history. We don't talk about, we talk about it when it happens to us. So when someone gets diagnosed, well, oh, such and such got diagnosed when they were, well, had we known, then we would have taken preventative measures to make sure that we were staying on top of our health. But like you said, just sharing our stories and finding women of color, people that look like us, to share their journey, share their stories. That's so important because there's not a lot of, again, not a lot of representation of us out there. And it does give others hope, and it does give them encouragement when they see others out there that have gone through something similar. Oh, well, hey, Tisha's been through, she's gone through cancer and she's doing well. I know that I can do it too. So she can do it. I know that I can do it.
Yeah. And I know one thing that I've noticed too a lot when we're sharing stories, and I'm learning so much about women and their backgrounds and how they got to this phase of their life. A lot of the women that we share their stories, they were taking care of their bodies before this. They were doing the right things, exercising, eating healthy. So there's also the stigma of, what did I do wrong?
Yes.
And I think a lot of the times that prevents people from being comfortable sharing or going to get checked out, because it's like, no, I'm doing all the right things.
Yes.
And I think that plays a big part too, the disparities of, our environmental factors. Where are our communities of color, able to access quality treatment, quality food, quality living standards? And so there's so many things that impact our health that are out of our control,
right,
that women shouldn't feel like, I did something wrong. There's nothing to be ashamed of if you're
absolutely
going, treatment or whatever health issues. So I think that's part of people kind of keeping it close to the chest, feeling somewhat ashamed of something that they shouldn't be.
Yeah, no, absolutely. You should never be ashamed of never be ashamed of that, because like you say, you didn't do anything wrong. And I can remember when I was diagnosed and going through my journey, I was, in my opinion, I was in the prime of I thought that I was healthy. I was exercising. And I was the first in my immediate family to get it. It's like, well, did I eat some? Was I eating the wrong foods, or what did I do? Did I expose myself to something that caused this cancer? And then one thing too that stuck out at me, as an African American community, that we do, especially women of color, we take care of everybody else except for ourselves. And when we do, we self-medicate, and we don't go to the doctors like we should, because we are so busy taking care of family, taking care of everybody else except for ourselves. And then when we do get down and sick, unfortunately, oftentimes it's not a good prognosis. So we got to do better with that. Like you said, just whenever there's something wrong, staying on top of our health. We have to do better as a community to make sure that we are staying on top of our health, so that we can beat this and live our best lives and live our best lives. One thing that as you were talking, you also mentioned representation of women of color in the breast cancer community, especially in breast cancer campaigns. Whenever you see ads and commercials for breast cancer, you don't see a lot of us. And I'm thankful that we have organizations such as yourself and organizations like For the Rest of Us that are allowing more women to be represented, so and out and shown out in the community and out in the world, so that people can see, we're here too. We get, unfortunately, we get cancer too, but we want to make sure that we are getting the equitable health care, and that we can, like our counterparts. So how do you, in your foundation, rather, excuse me, how do you get women of color to participate and represent and have more representation for breast cancer campaigns?
Yeah, no, absolutely. So one thing that we started last year was we started to do a lot more partnerships. So like this partnership with For the Rest of Us, there's a few other organizations like Survivor's Nest, Oshun Charitable Organization, a bunch of different groups that are also targeting a similar group, even if it's a different type of cancer, but really kind of banding together and saying, hey, we know that you have, a few thousand, 100, whatever it may be, women in your corner. We have some here. Let's join together. Let's make sure we're kind of sharing our platforms, our resources, and we found that that has really given us the ability to connect with more women. We have a grant that we've been able to support women financially and connect them to direct financial support with our other partners. And it's just been another way to say, you know, let's pool our resources. Let's figure out how we can fill the gap of, you know, organizations that maybe have one specific focus area and they're the experts in that space. Let's connect our community to them, and their community can come and be connected to ours for what we do best. So just really kind of working as joined forces. I think that's what's really important, and making sure that our community knows that there are organizations that exist, that care, that understand them. I've spoken to women, unfortunately, more occasions than I would like to admit, who have said, I've went to my doctor, my social worker team, whatever it may be, and asked, are there organizations for women in my demographic, young Black women, young Hispanic women of color, you know, and sometimes they're flat out told no, and that's simply not true. We exist, we're here, we need to, you know, shine a light on one another so that whoever finds us, we're able to kind of open them up to this world and say, you know what, there's thousands of people who have been in your shoes before. You are not alone, and you have a community behind you. Yeah,
because it makes them feel disconnected, especially when they reach out and their doctors are flat out telling them no. When there are, I'm fortunate. Well, I am so glad that although I found my organization, For the Rest of Us and other organizations for women of color after my diagnosis, and after I finished treatment, but I'm so glad that I found them, because now I could, you know, these are organizations that now I'm a part of, because now I want to pay it forward, and I want to help those that are newly diagnosed, that are going through this journey, that, like you said, hey, we are here. And and like you said, joining forces, there's strength in numbers. Yes. And when we get together and when we just show the world that, hey, we are here, that gives those that are going through this journey, it gives them a sense of hope. It gives them encouragement to let them know that, you know, there is somebody out there that's gone through the same thing that I've gone through. And I know that if I need to reach out, I could reach out, because they can understand. They understand. They know what I'm going through. And that's good. And I'm so glad and thankful that now more, you know, national and grassroots organizations for women of color are starting to come out in the limelight now. And it's about time. It is way overdue. It is about time. And one thing that I do love about this organization, For the Rest of Us, you know, they are just actively bridging that gap and just making those aware that, hey, yeah, we're here. And we are here for you. You don't have to do this alone. We got you. And it is a safe space for you to come and, you know, get the information that you need, to get the encouragement, the support that you need. So I'm truly thankful for that. One thing that I want to also talk with you about is the treatments that women of color that women of color get when they are diagnosed with breast cancer. A lot of women of color, or an African American community, and women of color have lack of health insurance, or live in areas where they aren't accessible to adequate health care. You have women that are having to make hard decisions, whether to put food on the table or get medical treatment. And it should not be that way. And that definitely affects their prognosis. How does talk to us a little bit about how does Chemo Divas, how does they help women in those particular situations? How do they help them to be able to get the adequate health care that they need?
Yeah, I'm so glad you touched on this, because I think this is a huge part of survivorship that it can't be spoken about enough. So initially, I created the organization just kind of as an Instagram page to share stories. And then unfortunately, my mom did pass away. And after she passed away was when I said I wanted to actually create a nonprofit organization.
Right.
And so one of the first things we did was fundraising for our grant program. Because I said, I know firsthand that, money doesn't solve everything, but it makes things a lot.
But it makes it a lot easier. Right. It makes
your
it
options
easier. Yeah.
So we raised money. We had like a 5K fundraiser, and we opened up the grant program, and we had an overwhelming amount of women who were just in need of support. And you read their stories, and like you said, you're hearing women who say, I am deciding between purchasing or, getting my prescription medications and making sure my child has food, or, paying for gas, having to pay for Ubers. Yes. And so we were so blessed. We actually got a partnership with an organization called Family Reach. And they have been able to help connect our women to their financial resources as well. They have a cancer equity initiative program where they're targeting organizations like ourselves that are trying to better communities of color who are impacted by cancer and fill that financial support gap. And so we've been working closely with them. And to date, we've been able to connect women to almost $50,000 in direct financial assistance via that program, as well as our Chemo Divas community of fundraising and donations and events. So we're really trying to hear our women out, understand what are these disparities that they're going through, take their stories, structure our organization to be able to fill those gaps. And in the meantime, being able to say, okay, I know that right now you just need food on your table. You just need your electric bill. You need your phone bill, because how are you going to get in touch with your doctor?
Exactly.
Your phone bill. People don't understand there's so many pieces of your life that is touched by cancer. Yes. Everything.
Yes.
Is impacted, and the smallest thing going awry can have a huge impact on your survivorship. So we're really trying to at least address this big piece of the puzzle, the financial side.
Yeah, because you're trying to survive. Mm-hmm. That's the one.
Not to stress. They say don't stress.
Exactly. You're trying
like, I can't afford to not stress.
Exactly. And it's so unfortunate, but I'm so thankful that with organizations like yourself again. And I just want to thank you for, the things that you are doing to help make it less stressful for those that are that are in those situations. And with this organization, for the rest of us, they also connect women with, a plethora of resources that will help financially, because again, no one want to ever have to make that decision of whether or not to get medical treatment, or like you said, to make sure your child has food, or make sure that you have gas in your car to get back and forth to the doctor, or even to get back and forth to work, because some people still going through treatment still have to work. I had to still work. And I was fortunate enough that I was still able to work as I was going through treatment, but some people that are impacted by breast cancer don't have that option. And when they don't work, they don't get paid. And that is the last thing that they should be thinking about. The only thing that that should be on the forefront of their minds is, I need to beat this cancer.
Yeah.
And I need to survive. I need to get past this. I know that talk to me a little bit about clinical trials and what how Chemo Divas, because we all know that there's not a lot of representation for women of color that participate in clinical trials for a number of reasons, and one being that off the top of my head, because many don't trust. It's a trust issue. Just the lack of knowledge.
Yeah, I can definitely speak to that. So very early on in my mom's journey, maybe about 6 months into her treatment, they told her there weren't any other options. They didn't have anything else. They ran out. And we were kind of just looking at each other like, what does that mean? What do you know?
Yeah.
So we were not informed about the clinical trial process. We were blessed enough to have a family friend who was a physician who told us about MD Anderson in Houston, Texas, who they do very rare cancers. They're experienced in cancers that a lot of the times maybe your local physician hasn't treated as much. So we ultimately ended up going to 6 or 7 different hospitals during my mom's treatment. But we went to Houston. Actually, like the day the pandemic started, we were there watching the news, and ultimately got enrolled in a clinical trial there, which undoubtedly extended my mom's life more than we ever would have thought.
Right.
And she was kind of had a similar sentiment when she heard about clinical trials initially. I'm not a guinea pig. I don't know what, treatments they're going to put on me and test out on me.
Yep.
But I will say that actually the physician that we worked with, the oncologist that we worked with the clinical trial, just so happened to be the first Black woman that was an oncologist that she got treated by.
Okay.
And I do think that had something to do with it, the sense of comfort and being able to connect with Dr. Hill. She's actually out of Houston Methodist, or she was at the time. But it was just amazing to see the change in my mom's spirit when she was properly educated and informed and sat down and really was able to have a conversation about what it meant to be a part of the clinical trial.
Yeah.
And, of course, there are going to be risks in any trial. There's risks in any treatment. But I'm just so grateful that, one, we had somebody in our network that was able to inform us about the clinical trial process and a type of hospital, like where it's available, versus just kind of relying on what was our medical team at the time, that in my heart of hearts, I felt like they didn't inform us about the process because they assumed that it's not something we would have been able to do, which, like, if my mom was here today, she'd be like, nobody can tell me what I can and can't do but God. Like,
God, absolutely.
I told her, like, if they go to Timbuktu, we'll raise the money and go to Timbuktu. Like, we'll get you there. So we were traveling between Atlanta and Houston over the course of about a year. We had to temporarily relocate, paying, utilities, bills, everything in both places. But when it's your loved one, you do whatever you have to do.
Absolutely. You do what you got to do.
Yeah. And so I was just grateful that the clinical trial process was an option that was made available to us, and that we were able to actually be educated enough to feel comfortable making that decision. I think that's the missing piece. It's not telling people that they should enroll in a clinical trial or that they shouldn't. It's giving them the information that they need to feel comfortable enough to make that decision.
To make that, and giving them the option. Absolutely. Education is key.
Yes, I agree. Absolutely.
Education is key, especially when it comes down to clinical trials, because, again, like you said, there's not a there's not a lot of knowledge especially with women of color. They don't have a lot of knowledge of that, and just sit down and just explain it and allow them to get comfortable with, okay, you know what, this may be something that I may want to try. Give me that.
Yes.
Don't just say, that you can do a clinical trial and that's it. Well, I'm like your mom. Well, I'm not going to be a guinea pig. I don't know what you're putting in my body, but if you would take the time to educate me and tell me, okay, well, this clinical trial is going to do this, and this. And allow me to ask questions if I need to ask questions, and just take that time just to, again, get me comfortable.
Yeah. Yes.
And give me that option of saying, yeah, you know what, this may be something I want to try, or, no, I don't want to do this. Is there another option? So for those of you that are listening out there are options. You have the option of doing a clinical trial, but one thing that I will say, make sure you educate yourself, get the information so that you can make that sound decision of whether or not this is something that you want to do or is something that you don't want to do. But we are underrepresented, and we need to have more women of color that participate in these clinical trials so that we can get the data to say that, oh, this clinical trial has worked.
Mhm.
This clinical trial has worked for this demographic. This clinical trial has worked for this demographic. But unless we get to that point where, like we said, like we just talked about, unless we get them to the point where they are comfortable enough to participate, we won't have the data that we need in order in order for the breast cancer community, the medical community, to make those decisions and to be able to um, get the data and make those, what am I trying to say? Get the technology and the medicine that they need in order to make sure that we can bridge this gap.
Yes, and I have to shout out our vice president, Naomi Smith. She actually works in pharmaceuticals, and she's a woman of color like myself. She unfortunately lost her mother to cancer as well, but she has kind of carved out a space for herself. She's working in the clinical trial space in her organization to have more representation. So we're excited to just be able to kind of understand what issues are facing our communities and how are we able to take that knowledge and implement it, in Chemo Divas, in our day-to-day roles and work, and really make an impact on our community. Because like you said, if there isn't enough representation in these trials and they don't understand how these treatments affect our bodies and, our systems and the specific types of diseases that we're getting, then that's making an unfair advantage for us to not get the right survivorship, the right statistics, the right outcome. So we want to show up and make sure that, people are understanding that we're here. We need these resources as well. And so whatever tests and information is being done and technology and advancements, those need to benefit our community too.
Absolutely. But, it not only affects us physically. Breast cancer not only affects us clinically, but it also affects our emotional and our mental health as well. Especially when you're going through, breast cancer, and it's just the thoughts that go through your mind, and whether or not you're going to survive this thing, or whether or not it's going to am I going to live, or honestly, am I going to live or am I going to die? That is stressful, and it takes a toll on you physically. It takes a toll on you mentally. How can we help those women of color in that aspect of, making sure that we not only stay on top of our health physically, but we stay on top of our mental health and our emotional health?
That's a good question. I wish I had the perfect answer.
Honestly, I don't think there is a perfect answer, but there are things that I feel like we can do to make sure that that we are staying on top of our health, our mental health, and make sure that we're doing some self-care.
Yeah. So I can speak from, because I have not dealt with like cancer in the first, hand basis. I was my mom's caregiver. So from that perspective, I can
absolutely speak on that, because you were impacted by it just like your mom was. As her caregiver, you encountered some things too. So absolutely, please share on your perspective as a caregiver. How did it affect you mentally?
Yeah. No, and I think what you said too about like just constantly thinking, is my mom going to die? And I was 25, I believe, when my mom was diagnosed. She was 48, maybe 49. No, 48. She passed at 50. And so just thinking at that time, I assumed we had so much more time left. And now my mom is sick, and my mom was a bodybuilder. a personal trainer.
Wow.
She was like Superwoman for real. So yeah, so it never crossed my mind that my mom would be sick and I would be caring for her at such a young age, her young age.
Right.
So mentally, it did take a toll. And I know something that I always struggled with was people in, good intentions, but telling me you have to be strong for her. And I did, but also it almost felt like we were expected to always be happy and put on a smiling face, even on days when you're like, we just got the worst news we ever could have heard. And people are still expecting us to like bottle our emotions. And I think that's something that I would recommend to anybody going through cancer as, a patient, a survivor, a caregiver, a family member, is give yourself grace. Don't feel like you have to be positive all the time to everybody.
It's okay to not be okay.
Yes, and I have to tell myself that. Listening to what I say as well, because a lot of the times it does feel like, again, our community is expected to be strong and resilient. And, of course, we have God on our side. Of course, we've been through, hell and back, and we can get through this. Yes. But at the same time, you are human. And your emotional state is almost as important as getting treatment. And, it's all integrated. It's all a part of, a machine. And so being able to really, connect with those emotions, give yourself time and not feel like you have to put on a mask and put on a face, because that's exhausting and unsustainable as well.
Absolutely.
Finding those outlets. Is it journaling? Is it going for a walk? Me and my mom used to just put on comedy shows on Netflix and just laugh. Like,
that was my thing. I needed to laugh.
Yeah, just laughing. And we're like, what are they, sometimes it'd be the most inappropriate things. We're just laughing. You have to do what you need. And then sometimes it's just crying.
Oh, absolutely.
Ugly crying, because
yes, there would be moments. I remember when I was going through my journey, where I would call my best friend and I'm like, I don't need you to talk. I just need you to listen, and I need to just cry. And I would get it out, and then we'll end the conversation. She'll say something and it'll make me laugh. And we'll just end the conversation just laughing and just, crying, laughing, and hang up the phone. So sometimes you just, like you said, you just need that outlet. And I'm so thankful that we do have organizations that do give us that support. And they give us that outlet.
Yes.
I will say that, there's so many, there's, for the rest of us, they are wonderful with, having meetups so that, we all can get together and just fellowship and just laugh and cry and talk. And it's just, it's a safe space, and you need that. And, it's so important to know that, there are organizations out here such as Chemo Divas, such as For the Rest of Us, and such as other organizations out here. One that I know off the top of my head in my area where I live, Pink for the City, there are organizations out here that give you that outlet, that give you that support that you need, so that you can share your experiences, so you can empower, so you can connect. And know that you don't have to go through this alone. For those listening out there are so many organizations out there that you can be a part of that will give you the encouragement, will give you that support that you need, to also let you know that, hey, we're here for you. We have done it. We have gone through the journey. We know what you're going through. We know what you're feeling. And we are here for you.
Yes.
And that is so important.
Yes. And I love what you said too about you calling a friend. I think that's something too, that even if there's just one person that is your go-to person, you can call them and say, look, I don't need you to hype me up today. I don't need you to give me a pep talk. I just need to get it out.
I just need to get it out.
Yes.
That's it. That is, And even as a caregiver, like you said, although you weren't directly impacted by cancer, but you was a caregiver, and you were affected too in ways. So it's good that excuse me, that you're sharing your perspective on what you do, because there are listeners out there that you may be the caregiver of someone that is going through cancer. So, like you said, journaling, comedy, just finding something on TV to make you laugh. I love stand-up comedy stuff. So I was always watching comedy shows. I was listening to music, and I love music too. So I would listen to music. I would put on concerts in my house. I would put on concerts in my house, just something just to take my mind off of what I'm going through. And journaling, that was another thing that I did, and I still do to this day. It really helps me when I have all of these thoughts in my head, that it's like, okay, I got to get it out, and so writing for me helps.
What you said about concerts too, because I sometimes will scroll through my mom's phone and find videos of her just dancing, having a ball by herself.
Oh,
and
wow.
when I think about it, sometimes I'm like, we also have to remember that, like, culturally, we are a soulful people. We love to
we are.
We love
Yes,
to
we are.
We love music. We love to laugh. It's like getting back to those things that sometimes we don't realize. Like, those are the things that heal us from the inside.
Exactly.
And when we're at treatment and we're getting our, whatever it may be, chemotherapy, radiation and stuff, of course, that's treating medically, but remember to treat yourself from the inside. Treat your soul.
Absolutely. Because you have to take care of the whole body.
Yes.
Like you said, from the inside out. Take care of the whole body inside out. And yes, I love that we are. So I love us.
Yes.
I love us.
It's like Chemo Divas. That's what we are.
Yeah, we are.
Every time I read a woman's story, I'm like, you could feel it. You can feel that they've been through this and they are still a diva nonetheless. They are still walking this world, walking this path in a way that just it's us, it's our community.
And we need to absolutely, and we need to do we got to do whatever it takes to make sure that our community is well informed.
Yes.
Our community and well informed of what needs to be done to make sure that we are staying on top of our health when it comes down to cancer, and to know and educate our community to know that there are resources out there.
Yes.
There is help out there. You do not have to go through this alone. There's so many resources out there for you to research. There are so many support groups out there that you can become a part of, whether it's in person or virtual. But know that there's someone out, that there are resources for you, so that you won't have to go through this alone.
Yes, absolutely.
Tatiana, I could just talk to you all day.
Yes, I know. I
could talk to you all day. This was a wonderful, wonderful conversation. So before we end our chat today, I want to thank you again. Thank you so very much for joining me today. And for those that are listening, how can they connect with you?
Yes, so I will say thank you all, for the rest of us, for having us, for being a partner. This has been an amazing conversation. If you would like to learn more and connect with Chemo Divas, you can follow us on Instagram at Chemo Divas with an S. You can also visit our website, chemodivas.org. There you can subscribe to our newsletter, and we can also just make sure we're staying connected via, if you do Facebook, we have that as well. But mainly I would say Instagram is where we spend more of our time. And then as we have more communications and events, if you want to stay abreast of that definitely will be in your inbox if you subscribe via the email. So,
okay. Well, for those that are listening, you heard it, because I know I'm about to connect with Chemo Divas. So I have a new friend. Thank you so very much. And I want to thank those that are listening today. And I hope that you were blessed today as I was. Again, Tatiana, thank you so very much. And everyone, thank you for tuning in. And make sure that you subscribe to Baddie on Spotify, Apple Podcasts, or whatever you listen to for your favorite podcast. And again, my name is Tesha, and I'm a breast cancer survivor and a Baddie volunteer for the Breast of Us. And I want to thank you all for listening today and coming on and listening to our show. And Tatiana, I wish you nothing but the best. I thank you so very much, and we will talk with you soon.
Thank you.
Bye-bye.
This is another Baddie creation brought to you by For the Breast of Us. Don't forget to subscribe to Baddie to Baddie wherever you get your podcasts. And follow us on Facebook and Instagram at For the Breast of Us, on Twitter at The Breast of Us, and check us out online at breastofus.com. Thanks for listening.